Are you curious about a low carb or ketogenic diet? There's no question that the strongest, most rigorous evidence to support chronic disease reversal is with a ketogenic or low carbohydrate diet. We have more than 100 clinical trials now, and there's no greater amount of clinical trial research except for on a Mediterranean diet, which simply doesn't achieve the same promising results. A ketogenic diet may be superior to other diets in terms of weight loss while maintaining or even improving other health parameters. Some key points to be aware of are as follows. A ketogenic diet offers an improved regulation of hunger and satiety. It is known that hunger and appetite increase on a low-calorie diet, making weight loss a much more difficult process. Conversely, the ketogenic diet increases the feeling of satiety and mitigates the feeling of hunger, despite a negative energy balance and weight loss, unlike in carbohydrate-based diets. Weight loss is greater during the initial phase of the ketogenic diet as it reduces water retention and lowers glycogen levels in the body. In addition to the effect on total body weight, this may be important from the psychological perspective, as individuals who experience rapid weight loss will be more motivated to adhere to the diet. The spikes and diurnal fluctuations in glucose and insulin concentrations are smaller because the ketogenic diet meals do not raise glucose levels or insulin levels as much as carbohydrate-based meals. In the absence of pronounced glucose fluctuation, bouts of hunger and overeating during the day are less likely, and overall daily glycemia, as demonstrated by the HbA1c levels, is improved. Lower glucose levels support lower insulin levels, the sensitization of the body cells to this hormone, and reduced insulin resistance, which often accompanies obesity and being overweight and hinders weight loss. Ketogenic diets may help reduce inflammation associated with being overweight and obese to a greater extent than weight loss alone. The effect of the ketogenic diet, unlike carbohydrate-based diets, offers similar potential benefits to those of obesity medications, but without side effects. The ketogenic diet reduces the feeling of hunger, example by affecting the hunger and satiety hormones. It improves glycemic control and also lowers energy intake, even without intentional calorie restriction, which is more difficult to achieve with other dietary approaches. Weight loss on the ketogenic diet can be more enjoyable relative to low-fat diets, as it can simultaneously improve mood and cognitive function. Many studies show that the beneficial, even therapeutic, psychological effects of a ketogenic diet are superior to those of carbohydrate-based diets, exceeding those expected from weight loss alone. The best results are achieved by using a low-calorie ketogenic diet, and the calorie deficit itself can often be achieved intuitively. And multiple randomized controlled trials indicate that the ketogenic diet is more beneficial in body weight and fat mass loss compared to other dietary interventions, even when caloric intake is equal in the compared groups and/or both groups consume ad libitum. In fact, in some studies, subjects in the group using another diet were asked to reduce their energy intake compared to the ketogenic diet group. With the insulin and measurements we use at TaylorMade Performance, you are directly able to see the impact of your lifestyle change from the inside out. Find out more by getting in contact with us. So look after yourself. You're pretty important to the loved ones you surround yourself with.